Hello students, we'll just go through one more instrument. We'll have an idea what exactly, just identify what is it, which is not that commonly used, but mainly used in the abdomen surgery and gynec surgeries. So what this instrument is, so look at that, like this it is. Stout blade and with a right angle, something like that, right angle, like this, and stout hand like this. So like this it is. What is this instrument? This is a Keyland Retractor, mainly used in the pelvic surgery, in the gynec surgery, even in abdomen surgeries. What are the features? It has got a broad blade with the right angle of the handle. This right angle handle is important. And what are the uses? To retract organ and soft tissues in the deep cavities like abdomen, thorax during major surgeries, similar like Deaver's retractor. It's similar like Deaver's. Deaver is there is a curve like this. Here it is a right angle with the handle, it like this. So Deaver is single like this it is, whereas this is little different from that. So that is Keyland Retractor, mainly in the gynec, in abdomen surgery it is being used. It is like a similar action like a Deaver's retractor, but it has got a right angle here. So little more sharper than the Deaver retractor. So please go through my SRB clinical methods in surgery current edition with the proper clinical examination. In detail text is there, video lectures are there. My SRB is manual of surgery, detailed CBME syllabus covering every topic including specialties with the quotations, with the illustrations, photos, with the case scenarios, with the online MCQs. My operative surgery book, 2-volume book in detail, small minor procedure to detailed major procedure with the proper diagram, illustrations, voluminous book in detail before going to doing any surgery, even small minor surgeries. You can always go through this book and do the surgery safely and comfortably and boldly. And tissue atlas approximation, lots of tissue approximation to fine suturing technique, which is detailed around 100-page book with, of course, mostly importantly, corresponding video lectures about that. My digital lectures of entire surgery topic as per CBME syllabus, from small first topic to last topic, and everything is covered with the operative surgery, X-ray, specimens, instruments, specialties, urology, neurosurgery, cardiothoracic, and so on. Everything is covered. Please subscribe for 1 year. You can easily have the idea about the entire surgery topic, useful for postgraduate also. So student, hope this specific Keyland instrument you have understood very well. Thank you very much.